Good morning, welcome back. So this is the first short talk about the introduction of genetic counseling and also the career path in overseas and Hong Kong. So to start with, I would like to illustrate by a case. Because I understand that some of you may understand what is the role of genetic counseling in clinical setting, but some of you may not understand. So this is actually a very good case to illustrate what is the importance of this element of genetic counseling in a clinical setting. So I would like to take an example of a case with sudden death due to non-QT syndrome. So this is a lady with 50, this lady is 50 years old. She enjoyed good past health and suddenly passed away because of long QT syndrome. So the diagnosis was made after she was passed away with the post-mortem genetic investigation, showing that she had a pathogenic variant on the gene, which is called CUHK1 on chromosomal 11. On further history taking from her sister, the sister told us that actually their father also passed away very early, but the underlying cause was not known at that time. So with the understanding about long QT syndrome, which is an autosomal dominant syndrome, well, the family members who carry this gene will have risk develop sudden cardiac death due to arrhythmia, such as ventricular arrhythmia. So therefore, it may be worthwhile to see who in this family will be at risk suffering from the same conditions. So further history taking revealed that this family this lady had 4 more siblings. And genetic counseling at this moment is very important. First of all, to take a very detailed family history, including the pedigree, and then provide a pre-test counseling. What is the importance of the test? What are the implications of doing such a testing? And who in the family should be offered the testing and who will be at risk. And understand that they may be having a 50% of risk. Their sibling all have gone through for the genetic testing, and unfortunately, 3 of them are also carrying the same variant. That means that they may have a higher chance of sudden death due to the complications of non-QT syndrome with ventricular arrhythmia. And these 3 siblings then we receive a postnatal genetic counseling. Because they are asymptomatic at the moment, they may not understand the genetic testing result. What is the implications of getting such a result? And actually treatment, including medical treatment, should be offered if they are carrying a pathogenic variant, if it is definite. And therefore, they will refer to cardiologists for further investigation and also management. And with the genetic counseling, they understand that it is autosomal dominance condition. That means their sibling may also have a risk to inherit the same genetic variant. So the recurrent risk is 50%. And therefore, the family pedigree go on, then we understand that they have a few offspring in this family, and therefore pre-test counseling have to offer to them as well. And all these offspring of this second generation, they are all above 18 years old. That means each of them that we should offer genetic counseling individually, and they can opt in whether they want to do the testing or they don't want to. So in the pre-test counseling, we may also need to know about the confidentiality issues. We may, such as I take this family as an example. One of the offspring, I mean the niece of this passed away lady, voiced out that even though with the testing, she may not want the parents to know about whether she's suffering from the same condition, because she does not want the parent to have this feeling that they have inherited the pathogenic variant to them. But then they understand the important medical implication. Therefore, going for testing will be good for their health. So all of them had go for genetic testing, and unfortunately, 3 of them also carry the same mutation. And since they are asymptomatic at the moment, so doing a testing will be beneficial to them. They can receive further investigation and also go for medical treatment if indicated. And so in this family, you can see that this is actually a very good illustration to you. You can see most of the family members are asymptomatic. That means they may not be having a regular medical checkup. They may not have any medical investigation before they present. So doing a testing may have a medical implication there. And at the same time, you can see one clinician, if she encountered a case of sudden death due to a genetics condition, it will result in a lot of follow-up and also family cascade screening, and that may generate a lot of workload for genetic counselors and also clinicians who also may need to do some genetic counseling to the family. And for one of the niece of the passed away lady, she is currently pregnant. And for the genetic counseling, it may also further involve in whether the fetus should go for prenatal diagnosis, and also for those who have no offspring yet, whether they should go for a pre-implantational diagnosis or not. All this due to the advancement of the genetic technology, actually right now, not just those rare conditions, there are many genetics conditions which may involve in prenatal or pre-implantational phase, and also postnatally, if the child is asymptomatic, at what age and at what circumstances should we offer genetic testing? And all these are important issues that the genetic counselors should give the comments to the family and also give appropriate advice. So you can see that genetic condition could affect 1 or 2 or 3 generations or more. So, so you can imagine the importance of genetic understanding and also counseling in the clinical practice. So genetic counselor will be collaborating with clinical geneticists, and clinical geneticists, while managing the patient, also need to have a close collaboration with molecular geneticists and also relevant specialists. And in this case, it will be the cardiologist. And in other cases, it could be neurologist, it could be surgeon, it could be other specialists who had encountered conditions which they think a genetic testing may help. And also oncologists and also obstetricians as well. So the nurse also play a very important role if there is no genetic counselor in the clinical service. And you can imagine if genetic counselor is not available, both the clinicians, the specialists, and the nurse have to share out the work of a genetic counselor. So this is actually a great demand of a genetic counseling service in the clinical setting. And more importantly, is the genetic counselor have to give us very specialized information which can offer the patient to understand about the medical implication, the psychological impact, the social impact, and also as well as the insurance implication after they have done a genetic testing. So the main job, the job description for genetic counselor should be that genetic counselor should have enough or high level, high standard of genetics and genomics knowledge, and they know about that kind of diseases that they want to counsel the patients, and also how to assess the risk in the family. Say, for example, a young family with one of the member having a early onset cancer. If a genetic testing is identified that one of the variants is causing early onset cancer in the family, who in the family should go for the testing? And how should they disclose this kind of information to those who are at risk? It really depends on a very good communication skills and also counseling skills. So communication is one point, but counseling, there are a lot of elements that you should put, the genetic counselor should put into the counseling content. So including not just the genetics and genomics knowledge, also like they have to understand about the law, the policy, and also the local insurance and also coverage, and also have to understand what are the other psychological impact that the patient or the asymptomatic person may encounter. Sometimes, since of the advancement of technology, we may identify some of the patients who only have very mild symptoms, or some of the genetic conditions. We could identify some variant which have unknown significance, which may not result in any clinical symptoms. And with the result, with a report of all these positive findings, sometimes it may be very difficult for the client to understand the medical implications. So the genetic counselor should equip a high level of standard of medical knowledge, especially in the genetics and genomics. So in Hong Kong, we don't have a genetic counselor specialized post at the moment. So how about in overseas? And in the overseas, say for example in UK, the genetic counselors are registered under the Genetic Counselor Registration Board, and the board is accredited by the Professional Standard Authority. And all the accredited genetic counselor, they should hold a board accredited master in medical in genetic counseling, or they could be an experienced nurse who had experience in genetic counseling, or a midwife who hold a master degree on counseling and human genetics. And you can see that the emphasis is put on the experience related to genetic counseling, because genetic counselor is not just for someone who have this medical knowledge working in laboratory. They involve a communication between patients and clinicians, between patients and laboratory, and also between the laboratory and also the clinicians. And so how about in the United States? They have an American Board of Genetic Counseling. So for those who are interested and taking into the course of master degree in genetic counseling, they have different programs. So I have listed out this website for you. If you are interested, you can take a look. Because in different universities, they offer different master programs, which if already been accredited by the ACGC, those graduates are qualified to go for a certification examination. After they have passed the certification examination with clinical experience, they can apply for ABGC certification as working as a genetic counselor. So how about in Canada? Actually, they are quite similar to UK and also US. So getting a qualification from US is also equivalent to CAGC, which is a Canadian Association of Genetic Counselors in Canada. So they allow for pathways for them to get through to the certification examination, and all pathways require a master degree of genetic counseling. And for those who want to apply to get into a master's degree, education background may not necessarily from nursing. It could be from biology, it could be from social work, from psychology, or even from other medical related healthcare undergraduate program. And for the clinical training, it consists of coursework in genetics and also genetic counseling theory, and also rotations to the genetics departments and the clinic. And in Australia, it is also similar to UK and US. They required a graduate holding master degree of genetic counseling program. And the first step for them is not immediately work as a genetic counselor. They will be employed as an associate genetic counselor. And during that 1 or 2 years, they will have clinical exposure to the clinical genetics department to work as an associate. And then later on, after they have equipped all the training requirements, they can apply to be a board eligible genetic counselor. And after they have all this training, which gone through the HSGA board, they can certify as a genetic counselor. So how about the genetic counseling? Our genetic counselor work in Hong Kong. So in Hong Kong right now, there is no specific job title at the public service sector as a genetic counselor. And genetic counselor could be working not just in clinical setting, could be working within research team, in laboratory, or private sector. And so right now for this existing service gap, what we are doing is our nurse and also our clinicians will provide the relevant information to the patients. So you can see that if there are more genetic counselors, we can enhance the service. Since the Hong Kong Genome Project will be started this year, we can foresee that it will generate a lot of public awareness as well as a lot of follow-up work after the project. Then genetic counselor could help to fill in the gap. So there is increased demand in the clinical genetics for genetic counselor. So in Hong Kong, right now we are employing nurse to work as a genetic counselor, and we also welcome those certified genetic counselors who come back from overseas to work in the coming years. And we'll try to work out, because for clinical genetics, in the past we don't have this specialty, but in the recent few years under the Hong Kong College of Pediatricians, we have a standardized training program. We have under the Hong Kong Medical Council specific subspecialist registration for clinical geneticists. And also, since the genomics genome project will kick off, that means with this geneticists, they are in a huge demand to collaborate with genetic counselor so as to carry out a good service and also a good impact to Hong Kong. And for the clinical service that I have mentioned, in Hong Kong right now, we have Department of Health, Hospital Authority, and also the university offering genetic service. And in Chinese University, we have the Joint Center of Medical Genetics with Baylor. And what after the clinical service, we have to think about education, because the impact for education is much, much greater than individual service. We have a professional diploma in genetic counseling and also medical master degree in medical genetics. And also after clinical service and also education, we have to think about for future genetic counseling in Hong Kong, we need a professional society. So therefore we have start up the Hong Kong Society of Genetic Counseling. We hope by doing all this, we can help Hong Kong to map out the future certification pathway. I guess it will be more or less similar to those pathway which I have presented to you in the other developed countries. And of course, the genetic counselor, not just in clinical work, not just involving in medical clinic, because the future career for them after they have got this qualification and also the clinical experience, they could also work in different research study as a researcher in the laboratory, or they could provide individual counseling service. And with the relevant experience, the public policy could also will also need this kind of expert opinion, and some of them can also think about whether they want to have a greater impact to work as an educator for future genetic counselor. So I think that's it for this morning for me to briefly introduce to you about the work of a genetic counselor. And I hope you understand the importance of this field. And please stay tuned with our website. We are going to provide more educations in the coming years. Thank you so much.